Thank you very much. Please welcome moderator Jason Marks, speakers Javier Becerra, Carice Etienne, Sara Biel, y José Luis Nuño to the stage.
Hello, everybody. Hello. So wonderful to join this panel today. There is the secretary. Wonderful to be part of this incredible conversation today. I'm Jason Marzek. I'm the Senior Director of the Adrian Arts Latin America Center at the Atlantic Council, where we work in a nonpartisan way, always to broaden understanding about the incredible transformations across the region, transformations that many of you are a part of, and always propose constructive results-oriented solutions. I know very well with this incredible crowd here. I'm thrilled that we're joining today the Young Americans Business Trust and also this audience of select youth delegates for today's panel. This is a incredible conversation. Thank you very much. Although I do have a habit of raising my voice, so but it's better with a microphone. Our panelists have really been at the forefront of confronting the COVID pandemic, and each one has done so from different angles. I'm really thrilled, Secretary Becerra, to be joined here by you, and Los Angeles native, and to be here in your incredible hometown that's given such a warm welcome to all of us. Of course, everybody knows here the Secretary of Health and Human Services, Javier Becerra. It's a real pleasure to have you here on this panel today. Also sitting next to me is the Director of the Pan American Health Organization, Dr. Carice Etienne. Next to her is President and CEO of the Inter-American Foundation, Sara Aviel. And also Jose Luis Nuño, who's the CEO of UNIMA, which is an incredible company that designs patient-centered diagnostic technologies in low-resource settings. So this is quite an incredible group today. I have two goals for this conversation, and hopefully speakers have the same goals, which is, the first is to understand how each leader harnessed your unique resources to protect and strengthen equitable access to health services and support global health conditions of the many diverse populations across the hemisphere. And then also second, incredibly important, is for this conversation to look ahead and discuss how greater synergy between government, private sector, and civil society can support each sector's work and also strengthen health resilience across the Americas. Very important that the questions that I'm going to pose to our speakers today are shaped by an extensive consultative process that was led by the Young Americas Business Trust and also the Atlantic Council. We have questions from youth leaders who participated in YABT's Youth in the Summit campaign or policy labs, as well as ideas that emerged during the Road to the Summit campaign that the Atlantic Council co-led with the Department of State. We're going to start off with some opening comments from each of the panelists, but first, I have a question for the audience. I actually have two questions for the audience. The first question is, just by a show of hands, have you seen bold changes by your government institutions due to COVID? Who has seen bold changes in their countries due to COVID? So a few hands have seen some bold changes. Let's see if we get some more hands on this one. This is an audience full of young entrepreneurs and thought leaders. Who here has come up with your own solutions in response to the pandemic to better support your local communities as a result of what we've seen over the last couple of years? So for our panelists, there's much more entrepreneurship that we've seen in this audience than people have seen their governments coming up with those bold solutions. But let me start off by starting things off and turn to you, Secretary Becerra, for some opening comments, and I'll then turn to you, Dr. Etienne, Sara, and Jose before launching into my conversation.
Jason, thanks for having me, and great to be with an esteemed panel, and really great to be with many of you. If I could just ask the audience a question, how many of you are from south of Panama? Yeah. How many of you are from Central America or the Caribbean? Okay. And how many of you are from what we would consider North Mexico above? Great to have you here. And anyone from California? All right. Even better, right? Well, enjoy the City of Angels. You should. I will say this, Jason. The best ideas are yet to come. And they're yet to come because you all have a chance to actually give them to us. And I hope that you soon decide to get heavily involved, because one of the things that we found is that the way we best handle things like this pandemic is by thinking outside the box. We are now using telehealth in ways that we never thought imaginable. But my suspicion is if we had asked a teenager, a young 20-year-old in America, how best could we reach communities that are often left behind, either because they're poor or in rural communities, how could we get to them faster and provide for their health more effectively? And they probably would have said, well, just start using these devices to communicate a little further, because even if the adults don't have them, I bet you their kids do, and their kids can help those adults get connected. And today we're using telehealth in ways we never thought imaginable. In fact, we're using telehealth in ways that we can't continue to do unless we're in an emergency situation. Because by being in this health emergency, I have powers to allow us to do things that we otherwise by law can't do, which include using telehealth. And so my suspicion is the sooner we get you from that seat to this seat, we'll come out with those out-of-the-box ideas that really solve problems in a fast and vigorous way for a lot of families. So we're very much looking forward to you coming and becoming the leaders of tomorrow. Thank you.
Mr. Secretary, and then we'll all be sitting in the audience then watching all the youth delegates here up on stage. So look forward to that moment. Dr. Etienne.
Thank you and good afternoon, and let me greet my fellow panelists. But let me say thank you to the young people here. Let me say thank you for your energy and thank you for your inquiring minds that almost knows no bounds. So as I also congratulate the organizers of this forum. So this year, the Pan American Health Organization celebrates 120 years of our existence, active work with all of the countries of the Americas. And we were born in response to the yellow fever and malaria that was plaguing the workers who were working on the Panama Canal. And today, we stand here with you, fully recognizing that we need your voice, we need your energy, your inquiring and innovative minds to constantly reinvigorate, renew, and to construct a healthy, prosperous future for all of us. And I know that over the years that you have struggled for inclusion in decision-making, for representation and expression, and often in the face of intransigence, established norms, and a status quo that is reluctant to listen to the voice of change. And I know that you continue to live that reality. But as we continue to transition through COVID-19 pandemic, we need more than ever this sense of questioning, of querying, a drive for change, and yes, youth leadership. And this pandemic has been an event of enormous consequences to young people. There is a misconception that young people were not very severely affected by COVID-19, but indeed you have. 15 million cases were reported between age groups 15 to 24, at least 40,000 hospitalizations, and more than 6,000 deaths. And these are only the measurable impacts. We have yet to understand what is the long-term impact of years of remote learning, of lack of social contact, of confinement within the home, often in situations where there have been domestic violence and interfamilial conflict. And what are the effects and impacts of youth stress and burnout? We do know already that there has been increased report of mental health issues among our youth. But I think we need to move to a point where we must acknowledge the call for greater convergence in health, the economy, and social policies that will provide a platform for better life, that will protect those in conditions of vulnerability, that will ensure equity, and not just to health, but also to the social and environmental determinants of health. We must, going forward, also urgently address the scourge of interpersonal violence that is so present in many of our societies and involving youth as well. And we need urgently to invest heavily in the health and well-being of our youth, from early childhood through the adolescence, with universal access to promotion, preventive, and curative health services, including services addressing the mental health of young people. I believe that to achieve and build resilient, sustainable, and more equitable societies in the Americas, we need action, and we need action now, and we need action by young people. And I really do believe that our young people must be at the heart and the center of such an action. So because of this, as director of the Pan American Health Organization, I have taken steps and I've called on our member states to implement evidence-based policies and programs and interventions that protect our young people and contribute to their health, psychosocial development. I have asked governments to support parents and parenting as the guardians of our youth and of our future, and to promote and support adolescent mental, sexual, and reproductive health with increased access for young people. Because if we look at it, young people do not necessarily have the access that they require to these services. We've also established a Young People for Health group. We have chapters in various countries, and this is to help PAHO to deal with health policy, but also into implementation of the health policies. And at PAHO, we really want all young people to thrive. We want your query, your quest for change, your energy and leadership. We want this to impact health and well-being, the decision-making at country level, and the implementation of programs that can drive us into a more sustainable future. So I wish to invite you to partner with the Pan American Health Organization in this journey as we look forward to the next 120 years, by which time you will not be here, but by which time you will have made a sufficient impact in terms of innovation, in terms of moving economies and societies forward, that the world will remember you as the generation that brought lasting change. So thank you so much.
Thank you so much, Dr. Etienne. Dr. Etienne and I we're talking backstage about her being in this leadership role at PAHO at this very precise moment, and how key of a role PAHO has played and will continue to play. And actually, Dr. Etienne, maybe with some of the innovations coming out of this audience today, we will live for another 120 years. So who knows? Sarah?
Thank you so much. It's an honor to be here along such distinguished guests, and it's an honor to be here in front of such a dynamic audience. And it's an honor to be here as the new president and CEO of the Inter-American Foundation. This is my first public event. I'm only a few weeks into this role, so I still have a lot to learn.
Congratulations. Great event to be your first public event.
But I'm just so honored to be leading a U.S. agency that has been focused on out-of-the-box ideas from the very beginning. We respond to the ideas of youth, of civil society organizations coming from local communities, and we fund their out-of-the-box ideas to respond to the problems that they face in their communities. And our fundamental belief is that you know how, they know how, that you know best how to answer the challenges facing your communities. And by investing in local institutions, that's where we see the biggest results. And we have the evidence to back it up. Each grantee partner does a different type of work, achieving different remarkable results, but the impact is extraordinary. So we've invested in a farmers cooperative in El Salvador that's succeeded in increasing incomes by 25% and improving nutrition. And as we know, all of the different pieces of health work together. So while we do some health, we also do a lot of kind of community health and resilience more broadly. We do a grantee in Guatemala that was focused on youth education and improving incomes, succeeded in reducing migration from over 15% down to 1% because they have opportunities in their communities at home. A grantee that we work with in Belize, which like so many of the places where we live has been marked by such violence, partnering with communities and the police to create community hubs was succeeded in having a dramatic reduction in violence. And so the results are extraordinary, as is the ability of local organizations who are on the front lines to respond to crises and pivot quickly. And as we know, our region is very vulnerable to so many different types of disasters and of course, COVID as well. And because our local organizations are on the ground, they can be flexible, they can be nimble, and we saw that with COVID. We had a grantee who worked with survivors of domestic violence, providing opportunities to make garments, and they pivoted to making masks in the context of the pandemic. We've seen a grantee that was working with community radio stations, retrofitted them to provide Wi-Fi, providing much needed access to technology in the midst of the pandemic. And for every type of disaster, even though we're not a disaster relief agency, we've seen that the local organizations that are on the front lines are the ones who respond quickly, whether it's after the Haiti earthquake or the Mexican earthquake or hurricanes. It's those who are on the ground who can move most quickly. And so I'll stop there, but just to reinforce the fact that it's through building the capacity of local organizations and partnering directly, many of which are led by young people, that we can really help fund these out-of-the-box ideas and have that effective impact on the ground. So thanks.
Wonderful. Thank you so much, Sarah. And for those, Inter-American Foundation is just really an incredible agency, and really it goes at the heart of trying to find these new ideas and supporting them from the get-go. Jose.
Well, thank you very much for the invitation to this panel. Of course, I'm honored to be with such an amazing group of people here. You asked about bold changes. If we have seen bold changes, for example, in governments. The reality that I've seen even more bold changes on young innovators. So during this pandemic, I've seen young innovators working, for example, certain kind of technology that was focusing on a certain kind of problem, and then they pivoted very quickly to try to address something very important challenges during the pandemic. It could be not just about diagnostics or access to healthcare, but actually, for example, on how to use e-commerce to provide very basic access to let's say masks and whatever, for example, or even some very young innovators trying to provide certain new ways of thinking on diagnostics, certain new ways of thinking on how to provide access to a doctor on areas where you don't have access to a traditional hospital, centralized lab, etc. So I do really believe that the future on resilience and the future on the disaster relief, etc., comes from this very young group of entrepreneurs that I can see today. We know, for example, of entrepreneurs half my age that are actually providing certain solutions using very deep technology that I find quite amazing that people are thinking that way right now. So it's very important that youngest generation of entrepreneurs are thinking out of the box, using very advanced technologies, because we have the technologies already. So there are artificial intelligence, we have biotechnology, we have every single kind of technology that we can use. But the most important thing is the innovators. How they are using these technologies to actually come with something that can solve the biggest challenge that we have. And right now, we are in this phase that we already went through the critical part of the emergency part of the COVID pandemic. But actually, we have other pandemics. We have TB, tuberculosis around the world. We have malaria. We have dengue. So we need to keep thinking on different ways of trying to solve these challenges. And I know that young innovators are the key for the future.
Yeah, and unfortunately, this probably will not be the last pandemic that all of us face. Secretary Becerra, let me move to you on a question about pandemics and natural disasters. And Latin America and the Caribbean is the second most disaster-prone region in the world, and also the region that suffered about a third of global COVID deaths over the course of the pandemic, if I have my numbers right, Dr. Etienne. These topics are often addressed separately, but each crisis, in fact, kind of exacerbates the effects of the other. So, Secretary Becerra, what support do you see that can be provided to countries to more effectively respond to health emergencies and natural disasters, and also the interplay between health emergencies and natural disasters that will continue to impact the region?
So, Jason, here in the U.S., we consider a environmental or climate crisis to be a healthcare crisis. And we have established in the Department of Health and Human Services both a climate change office to deal with the impact on health of Americans, as well as a environmental justice office to deal with the fact that those who are first and worst hit by climate disasters are those living today in the poorest communities, those communities that see the most invasion by infrastructure. So here in Los Angeles, you don't need to travel very far, just travel a little bit east into East Los Angeles, and you'll see the freeway interchanges that intersect what were whole communities and that have now been separated because of these massive freeways that crisscross throughout those communities. Those kids that are playing in those soccer fields and baseball fields every day are breathing in all the contamination coming from the stack of cars you see on the freeways every day in Los Angeles. And so at the Department of Health and Human Services, we now look at climate change as a healthcare crisis. And we understand that it's not going to happen in 2050. For some communities, it's already happening. You just drive up a few hours from Los Angeles and you will find communities in the Central Valley of the richest state in the richest nation in the world that can't open their taps, their faucets, and get clean drinking water. And so it is happening today. It is happening to too many. And so we're trying to tackle this now. Certainly we're not going to deal with it simply as a health crisis, but if we recognize that climate change is a healthcare crisis, we go a lot further in making sure that we take care of the wellness of Americans throughout this country. And if we do the same in the Americas, we can lift up the better being, the well-being of communities throughout the Americas.
Thank you, Secretary. Very excellent points. And as you're talking, I bet the audience is thinking about what kind of solutions they can implement to deal with some of these twin challenges that you mentioned. Dr. Etienne, from a regional perspective, we actually hosted you at the Atlantic Council, albeit virtually, in January. You talked about that we need a one region approach to the Americas to improve pandemic response and accelerate recuperation and recovery. Talk a little bit further. What do you mean insofar as what could be a one region approach? And also, how can regional mechanisms moving forward, taking the lessons from COVID, be more effective in responding to health emergencies, or as the Secretary is mentioning, the interplay between health emergencies and climate change?
So let's talk about the region of Latin America and the Caribbean, the wider American region. One of the characteristics of this region is solidarity. And I think it's important to make that point. We have had solidarity approaches maybe for a century or so. And it is this solidarity that has enabled us as a region to eliminate different diseases, to increase the access of people with HIV, AIDS, TB, and malaria to treatment, that has allowed us to address some of the shortages that we've had as a region, that we've been able to pull those demands, that we've been able to do stockpiles as a region and help countries access. But I think it's important to note that we do have great diversity in this region, in terms of rich and poor countries, in terms of countries that have capacity and countries without capacity. And we have a region where we have indigenous people, where we have Afro-descendant people who live in conditions of vulnerability. And I think it's important also to note that with the COVID pandemic, we saw the effects and the impact of nationalism, extreme nationalism, that impacted the ability of countries in our region to access the supplies, simple PPEs, to access vaccines and medicines that they require. So the whole question of not any of us is safe until all of us is safe. And so I think that one regional approach helps because we can have a regional approach to preparedness, to detection of infectious diseases, and to response. We have networks of surveillance that are created for respiratory illness that spans the entire region. We have networks of genomic surveillance, for instance, that we have developed, and thanks to substantial support from the US government and the Canadian government, we've been able to expand genomic testing across the region, so we have a good surveillance network. We've been able to build hubs of excellence in the region. We've been able to build reference regulatory authorities that, as from a regional perspective, is able to serve the rest of our communities. I think it's important, let's look at the common training opportunities for healthcare workers. And again, let me just refer to President Biden's announcement of ensuring some 500,000 healthcare workers. We have a deficit of at least 600,000 healthcare workers now. You tell me, is there any one government that can ensure that they produce sufficient health workers to even meet their needs? However, there are some countries that cannot produce at all. And it is coming together as a region and addressing this need for access to training opportunities that we can ensure that the vast majority of our countries would have access to trained healthcare workers. We need also, very importantly, to build the regional capacity in manufacturing and production of vaccines, of medicines, of preventive protection equipment. So when we think of what can happen, we can have each country developing what it thinks is its own expression, working with the private sector of vaccines or some other manufacturing enterprise. But we as a region need to ensure that every country in this region, that every individual in this region has access to the medicines that they require, have access to vaccines, and particularly in an emergency situation. The only way we can do that is through a regional approach that will reduce the dependency that we saw on in extra regional. And we need to be able to share information. We need to have the databases interoperable that countries can access across the region to gain different types of information, training, but also information to disease surveillance and responses, etc. We are working on a regional vaccine record. Every country wanted to have their own COVID record, vaccine record. We are working on a regional vaccine report. And I think when you think about it, to face an emergency, we need regional stockpiles. Not every country can have their stockpiles. There are some countries in our region that will never be able to have stockpiles. So on a regional basis, we can have stockpiles. On a regional basis, we can have emergency medical teams, and we can have lists of experts that from a regional perspective, we can move from one country to the next with having made the arrangements. And so I think we need to go beyond the national approach, recognizing fully the sovereignty of each country, but to pool what our resources, our capabilities are to ensure that everyone in our region has the access and can live a healthy life.
Thank you, Dr. Adi. Those are excellent, excellent points. What was faced over the course of the pandemic, lack of healthcare workers in different countries, inequitable access to vaccines, and how do we take that moving into the future? Now, Sarah, the Inter-American Foundation launched with the Young Americans Business Trust, a Nova Action Challenge. And maybe you can explain a little bit more about that, but it supports young entrepreneurs who have bold ideas to local health dilemmas. I'm sure many of those folks here today have participated in that. I want to share your perspective with the delegates here on how partnerships between sectors can spur innovative ideas that really help to prepare citizens for future crises. And also in particular, and these questions today were also solicited from a number of youth delegates, and Donalise Ansa, who's a young Venezuelan leader, specifically is interested in what the role of the next generation can be in these efforts to spur innovation.
Thank you so much for that question. And thank you also to the Young America's Business Trust. We were delighted at the Inter-American Foundation to partner with this Innovaction Challenge. And we worked to solicit ideas from individuals across the region. We specifically made an effort to reach out to underserved, remote communities to get the best ideas for how to respond. And I think some of the winners are here. If you are, raise your hand. There's incredible stories of one of the winners is a chocolate, artisan chocolate made by indigenous Mexicans in one of the poorest communities. There's a group working on civic participation in El Salvador, a group in Colombia working to connect underserved single mothers with opportunities to be able to work from home during the pandemic. So really excellent ideas, very responsive, and we were thrilled to be able to partner with the Young America's Business Trust to make that happen. You also mentioned sort of the role of the next generation and young people, which is just key to so many of the different partners and grantees we work with. I want to recognize Tracy over here, who's one of our grantees from COPIG from Guatemala. This is an organization that was founded by people as young as 12 in response to family violence that they faced, that now goes on to provide support to survivors of gender-based violence, legal support, psychosocial support, all of the different aspects. And so young, investing in young leaders and young ideas, it's never too early. The other part of your question that I wanted to focus on was partnership across sectors, because that's important at every level. Sometimes at the global or national level, it can be really hard. There's big bureaucracies that you have to sort of work across. At the community level, it's just natural, because we're all, one business owner is next door to the civil society organization and what have you. And I want to recognize another one of our grantees, Ivan from Honduras, who's working with he and a number of other Honduran organizations that we work with. Some of them started as farmers cooperatives and then went on to focus on youth and work in a lot of multi-sectoral, multi-dimensional approaches to addressing these issues. I think they enlisted 36 different public, private, and academic institutions to provide employment opportunities for youth and youth entrepreneurship. And because because they already have these array of partnerships that kind of cut across sectors and are multidimensional, it also means that when there's challenges, they can pivot quickly to address them. So one organization, ADEPIS, started off focusing on youth civic engagement, youth entrepreneurship. And then when COVID hit, pivoted quickly to assess what the community needs were in 100 communities, and found that 80% were worried about food security and that they wouldn't have food at all within 2 weeks. And so they partnered quickly with that network of partners that they had already been working with the local emergency committees and municipal governments to provide those food security needs. Again, because they are trusted in the communities and had already been engaged in interesting work, they partnered with radio stations to get out COVID prevention messages, reaching 12,000 people. And again, this kind of multi-sectoral approach, they had been working with young entrepreneurs. They partnered with financial institutions to provide credit and to be able to get those businesses the worst of the pandemic. And so what I think is special about this example is it's the type of initiative that, those of us based in DC or in capitals could never have sort of designed ourselves. It's by its nature, rooted in communities, partnering with the different actors and making a difference both in terms of the original activities that they were working on, but because you're focused on institution building and local capacity, they're able to build that resilience and respond more broadly.
That's amazing, Sarah. I think about what I was doing when I was 12 years old, and I certainly wasn't coming up with some of these incredible examples that you mentioned here. So Secretary Becerra mentioned about talked about the interaction between health and climate and steps that are taken. The particular challenge of Los Angeles, Dr. Etienne, a future vision of how the region can work together. Sarah, on the ways in which the incredible grantees of IEF are working across the hemisphere. Now I want to turn to you, Jose, because you represent your company, Umina, represents the entrepreneurial spirit that we're here talking about. So I'd like for you to share with the audience and those watching via video what you see insofar as lessons for youth, also civil society-led initiatives that can be replicated in communities across the Americas. Your company as well works even beyond the Americas as well. So what could be replicated, and also what kind of opportunities are there for adaptation for future health crises and what you've been able to accomplish?
Okay. Yes, of course I'm bullish about new innovators who can really make a change in the world. Just before the pandemic, healthcare is a very complex, let's say a very complex system. We all know that. And normally healthcare works on a certain pace, which goes between regulations, between technology, and between adoption. What happened during pandemic is actually quite interesting. We saw the first time, for example, that a vaccine came out just in a few months. That didn't happen. We had a technology called mRNA, which was lagging historically in terms of use. And then when company decided it was the great time to try to use it for vaccines, and we see what happened. So the technology is not the problem. The situation is about the willing of innovators to actually push the boundaries of what we can do. So during the pandemic, many things happened. We saw a vaccine in a few months. We saw diagnostic develop in a few weeks. We saw the possibility of scaling up access to vaccines and diagnostics at a very high pace. We saw the willingness of governments and international organizations to actually pull resources to fund this. So we have everything that we need to actually do this. We just demonstrated that. The thing is, we need those willing to push those boundaries. And I'm really, really bullish about new innovators that can actually do this. They think in a very different way than, for example, my generation thought. So, and if someone can make this change, is these innovators working with very high-end, very new technologies that can be thought in a different way of doing. For example, right now we have groups working with teleconference, for example, to get in contact someone who needs a doctor, but somehow you cannot access because of cost, because of availability, or because you live outside of the major urban area, for example. We have other startups working with electronic records to make available the same information for different doctors in order to actually make a better follow-up on the healthcare of a patient. We have groups that are doing diagnostic like us. There are other groups working on, for example, providing access to electronic pharmacies or whatever to actually provide this service in a better way. The problem is right now we are still seeing healthcare in silos. So we have this innovator doing this, and the other innovator doing this other thing, and someone else doing a different kind of thing. But to integrate everything, we need much more than just the willingness of doing this. We have, for example, governments willing to actually push this and work with these innovators to do something. So,
as an entrepreneur, what have you seen as successful examples to break those silos?
There have been some examples, for example, of certain governments doing these projects like piloting certain applications, doing like these kind of sandboxes when you can try to do something in small without actually damaging anything around it. So because it's something new, so with that you have to take risk. It had worked, for example, in fintech for new technologies and new ways of thinking. finances, etc. In healthcare, it has worked, for example, with telemedicine a little bit. I think it's one of the areas that's working much better for international organizations providing healthcare in developing countries, for example. However, I see that healthcare is still lagging on this. I really hope that what happened with the COVID pandemic actually is pushing the governments to think outside of the box and actually bring on those innovators to do something else.
Wonderful. Thank you so much, Jose. Secretary Becerra, let me turn back to you. We had some, as I mentioned, with questions that were proposed by different delegates of the Young Americas Trust. And one is a question from Wandy Guaquera, who's a young leader from Venezuela. And she mentions, and Dr. Etienne, you were talking as well about mental health and being sometimes a forgotten health challenge. And she acknowledges that in addition to COVID, her community, young people in her community in particular, face major obstacles in accessing mental health, as well as sexual reproductive health care services. What do you see, what are some of the opportunities or ways in which those issues can be better addressed moving forward?
So we in this country are facing a major crisis on mental health as well. We have seen the number of young people who are having suicidal ideation grow dramatically. We are beginning to see a ramp up in the younger age of Americans who are beginning to have major drug addiction. We surpassed for the first time in our country more than 100,000 overdoses in 1 year. And what we're seeing is that COVID just exacerbated everything that we knew was happening. We've not kept pace in terms of mental health, substance use disorder programs, and we're now trying to make sure that we catch up. And we're doing a number of things. Interestingly, this week, 2 days ago, I met with a number of high school students in a high school nearby in the city of Montebello, not far from here. And we talked about mental health and what they thought would be important. We ended up talking a lot about social media. And ultimately what we found is that most of these young people essentially said that social media probably was a deficit in helping them deal with mental health, not an asset. And it was interesting to find several of them say that they thought the best way we could really help address these issues for young people is by letting them have more actual face time with people, their parents, their families, their friends, instead of trying to do so much through social media, which I thought was very perceptive, because at the end of the day, if you're going through depression, if you're going through anxiety, if you're having a hard time coping, chances are you're not finding enough people that you can speak to and feel confident and comfortable relaying your anxieties and concerns with. And so I was thrilled. By the way, another thing I was thrilled to find, I should ask you all this. How many of you turn to Facebook for your social media more than, say, TikTok and some of these other sources? I was amazed that these young folks were saying that Facebook was for like the older generation.
So I should stop using Facebook.
Yeah. I remember MySpace, which went out of business because of Facebook. And it's fascinating to see what young folks are saying. So my sense is that we're going to find that doing some old-fashioned things are going to be really helpful, is giving people a chance to connect in person, not just through social media, will become really relevant for a lot of folks. As I said, it is interesting. There was a young man who was a recent immigrant from Honduras who said, he was very eloquent, and he said it in Spanish because he was still learning English. He'd only been here for about a year. He said, we really need to learn to put down our personal devices, and we really have to reach out to those who love us, because before we know it, they may not be around. Or for some of us, and he was speaking about himself and several of his classmates, you no longer have access to them. He had not seen his parents since he left Honduras and had come to the U.S., and several of the classmates, the same thing. They didn't have their parents with them anymore. They only had the people they knew through school and these new relationships they were building. And he made it very clear. It's very, very hard. And so, as I said to him in Spanish, because he again talked about the need to really speak directly to those who love you or should love you, I said to him, tanto lo que vale poder tocar. We forget how important it is just to be able to reach out and actually touch someone, or someone put their hand on your shoulder, because we're so consumed by this stuff. It becomes so impersonal. And so I think there is a lesson for all of you, because you are so connected, but really you are so disconnected from what makes life work. Go back to my days when, as a young person, if I wanted to make a phone call and I was in my car, I'd have to pull over at some gas station and find a phone booth that wasn't already being used. And I'd have to have the money, the coins, to be able to put it in to make the call. And then I'd have to hope that someone would answer, right? It's such a different world. But I think the message that he was sending, this young man from Honduras was saying, don't disconnect. Yeah. You're so connected. Don't disconnect. And I will finally say one last thing, and forgive me, Jason, because this one's important. We're going to have to take your leadership, those of you who are not from the U.S., on the issue of sexual reproductive rights, because we're on the verge of going backwards in this country when it comes to sexual reproductive rights, and we cannot do that. And it is only now that in certain countries in the Americas, it is fantastic to see. Argentina, which is the home of the Pope of the Catholic Church, is going to have a better set of laws to protect women and their sexual reproductive rights than the United States of America. That is crazy. We cannot let that happen, and we're going to need to turn to you. Because if you're like my daughters, and my daughters are all in their 20s now, they see a bisexual couple, they don't think a thing. They think same-sex marriage, they don't think a thing. They hear their friends who are dating people they had never met before except through social apps, they don't think a thing. All those things, to those of us who didn't have that opportunity to be so connected, are so different. But I bet in this country there are a whole lot of young people, especially young women, who are taking Roe versus Wade, the legal decision in the Supreme Court in 1973 that gave women a right to make a decision about their own body. They're now looking at this and saying, I was too disconnected. And I hope that you will teach us how not to be disconnected, because sometimes we take some of the most important things for granted, and it would be a sin, and I say that as a Catholic, a sin for us to yank from women in this country the rights to make decisions about their health with their own body. And we're on the verge, so we may be looking to you for real leadership on that one.
Secretary, thank you so much for those important comments. You mentioned an issue that's, I think, so personal to all of us, whether men or women, the importance of access to reproductive rights and equitable access. I want to, Dr. Etienne, I have a question for you. Then I want to, we'll just go, we have only a few more minutes, but I want to ask an important last question to the entire groups. But let me, Dr. Etienne, you had a question from Fabiola Alfaro from El Salvador, who had a similar question about what measures should countries across the Americas, and Secretary Becerra was alluding to that as well. What measures should countries across the hemisphere take to guarantee the rights of women, including access to health services, mental health, free of charge?
Thanks for this question. The first thing, the first premise that we need to agree on is that health is a human right. It's a human right that is enshrined in the constitutions of many of the countries of Latin America and the Caribbean. And this is a right that, irrespective to gender, to race, to place of residence, to sexual orientation, social class, etc. And not because it is a right, it is a government's responsibility, and one that governments cannot renege on. Now, under the whole rubric of universal health access and coverage, we need to make healthcare more accessible to women. It means addressing the barriers to care. In many of our countries, they are financial, they are cultural, geographic, and discrimination of every type in the health service itself. I think we need to begin prioritizing women children, and persons living in conditions of vulnerability, including migrants. Importantly, we need to look at the financing mechanisms because the way financing is organized, it actually acts as a barrier to women accessing those services. Because we have social security systems, some of them don't include women because they are not working. We have national health insurance schemes that are not covering every woman. And so we need to have those financial mechanisms that would guarantee this access. I would like to say as well that we need to strengthen primary health care services where you can have community outreach, where you can have times of service in terms of waiting times, in terms of access times to health facilities that are convenient for women. You need to have culturally acceptable healthcare workers and practices so women can actually access those services. We need rapid technology. If you're a woman in most of our Latin American countries and you want to have a pap smear, you have to come one day, you have to wait. Then they do the pap smear. Then you have to come back again for the results. And then if you need any form of intervention, then you have to wait how long and come back. We need to use those rapid technology. We need, and that's where we need your minds, so that we can have increased access to services on the smart, and then we better able to strengthen primary health care to deliver solutions, because it is taking too long. And for women, that's very important. Women stay home, but they have important work to do, and they can't just leave their home. So I think we need to look at the entire service. So it's not just, and in Latin America and the Caribbean, obviously, we also have legal issues as far as access to other reproductive health services like abortions, like even contraceptives. There are some places where women do not have access to contraceptives because of their own cultural norms as well. So all of this need to be addressed so we can ensure access not only to reproductive health services, but also to mental health services. The discrimination and stigma that is associated with mental health alone is the biggest barrier to accessing those services.
Thank you so much, Dr. Etienne. Now we're almost out of time, but I want to ask an important last question to Sarah and Jose, which is the fact that this audience we've been talking about is an audience made up of young leaders across the Americas who have all pledged to continue supporting youth development following this Young Americas Forum. So, Sarah, how can your work benefit from this next generation of thinkers, and what additional opportunities can you share for their involvement?
Well, I'm so glad you asked that question, because as I have been mentioning throughout my remarks, highlighting some of our incredible grantees, and I see all of you as potential grantees. So I want you to think about the examples that I mentioned, think about our work, and if you have an idea that you're working on in your community, please reach out. You can go to our website, iaf.gov, or we accept proposals all year round on a rolling basis in multiple languages. You can send it to proposals@iaf.gov. We want to fund the best ideas that are working on these intractable challenges in local communities, and we know that they're out there. Before I close, I wanted to also just make a point, picking up on some of these remarks that I hadn't, about how important social inclusion is to all of the work we do. It's just one of the criteria from the beginning. 80% of our grantees work directly with marginalized groups, gender, youth, and I wanted to recognize two more of our excellent grantees that are here. First, Cess over here, who works with LGBT communities in Colombia, and then Angela, who is working with mining workers in Bolivia, traditionally very male-dominated. When she first started working, there were no women on the boards of the mining cooperatives. Now every single cooperative has a woman on the board, is involved, and to the use of technology and the tools that can bring, they have worked to use technology to have more transparency about market prices, increasing their incomes by 10%. And so I just give these examples. The work we do comes from communities comes from entrepreneurs like you, and we're eager to fund the great work that you do, like the grantees that I've mentioned today that we're just so proud could join us.
That's fantastic, Sarah. Maybe the next time we come together, more of the audience will be filled with IEF grantees.
Exactly.
That's fantastic. Jose, I'm going to give you the last. You're an entrepreneur yourself. What lessons do you want to share with the audience about opportunities for their involvement and experiences that you saw insofar as that worked well to be able to become an entrepreneur yourself?
Yeah, so I think one of the most important thing is if we are talking about healthcare is, again, a complex area, and it's not about silos. It's about cross-pollination of ideas, cross-pollination of technologies. We have many different kinds of technologies. We have already artificial intelligence can go up on a smartphone, and we can do amazing things with it. We have biotech, etc. But the thing is, if we really want to solve a big challenge, we need to work together. For example, there was a project that we were analyzing with another startup in the US where we can provide a diagnostic to be used remotely and a teleconference to actually see that someone is going to take the COVID test, for example, to generate like a certificate that someone took the test and is negative, for example. This kind of cross-pollination is important. And I think the most important lesson that I have learned is you cannot solve a problem alone. Problems are complex. Yeah. You need to work together. You need to think you want to share. You need to share your data, your ideas, and hope that if we work together, we can actually solve something. Because me alone, I can solve a small aspect of this problem, but together we can actually fix this problem.
That's fantastic. Well, everyone, please join me in giving a really incredible round of applause for the incredible speakers today. Secretary Becerra, thank you so much for your insight. Dr. Etienne, Sarah, Jose Luis, look forward to the next conversation that we all have together. Thank you to the Young America's Trust, too.